Hi, so I wanted to make this quick video because I keep getting a lot of people who reach out to me and they tell me things like, oh, I have multiple personality disorder, or I'm bipolar, or I'm going through depression. And my first question will, as a professional, will be, who diagnosed you? And they tell me things like, oh, they went on the internet and they saw the symptoms, they had these symptoms and they Googled it, and it told them that they had multiple personality disorder. First of all, you cannot don't label yourself or your situation or what you're going through. It's a rule of thumb not to Google your symptoms. If you feel unwell, you feel something is wrong with your mental health, talk to a mental health practitioner, talk to a psychiatrist, talk to a psychotherapist, talk to a professional who have been given the tools to properly diagnose you of a situation. And don't run off with a 1 minute, 2 minutes explanation of any particular situation and it becomes sacrosanct that this is your situation without diagnosis. Information that you see out there is to give you a certain level of awareness, for you to begin to ask questions or meet your health provider, like the one I'm going to talk about today. Did you know that some of the depressions, the depression that you feel sometimes could be as a result of urinary tract infection, that is UTI? Did you know that treating a UTI can take care of the issue of anxiety, hallucination, sleep issues, and depression that you may be feeling? That the fact that you're having these mental health issues does not mean that there's no medical underlying situation. This is the reason why you need to talk to a healthcare professional. So what am I saying to you today? Before you go about, because this word depression, young people keep throwing it around like it's you see someone who is frustrated or who is having a sad day or who has been sad for a couple of days, they just tell you, I'm depressed. Like, seriously, take it easy, guys. Like, there's no joy in giving yourself names as to the things that you're suffering. So I have just given you a very valuable information, especially if you're a female, right? You could be going through depression. I don't want to belittle your experiences or undermine, what you think is going on. But before you run off saying this is what you are, get a proper diagnosis. And if you're going through depression, have your caregiver rule out the medical implications or the medical causes or things that would have predisposed you to depression medically, things like urinary tract infection. And that tells you how serious urinary tract infection is, right? So if you have an STD, a urinary tract infection, you want to treat it. You want to treat it and do a test that certifies that you no longer have issues. Urinary tract infections can block your fallopian tubes. Some of the fertility issues that women are going through is as a result of infections that were not treated. And then infections, especially in women, can also predispose you to ectopic pregnancies, right? You have an ectopic pregnancy, and I'm not speaking now as a medical professional. I will always refer you back to your doctor, right? This is general knowledge. But I will speak in my authority, in my field of authority, which is mental health. And I would say to you, don't go about labeling yourself, right? Or calling yourself names or saying you have this disorder or that disorder, you're suffering from anxiety, if you have not been properly diagnosed by a professional, not your friends, not Google, not your family members, okay? So if you're a woman today, one thing that you need to take out from this video is that you need to do, if you're going through any form of frustration, mood swings, low libido, sleeplessness, having hallucinations, you want to talk to a professional and have them also run a test for you, a lab test to be able to rule out the urinary tract infection situation, which could be a predisposing factor or a reason for the depression that you're feeling or the mood swings that you're feeling. I hope you find this video helpful. Give me a thumbs up if you did, and please don't forget to share, like, comment. I'm coming back around to doing videos again. It's been it's quite some months, but I'm getting there. And thanks to everyone who reached out to check up on me. I appreciate you. I'm still your favorite lady, Jane, the Love Coach.